At nearly 72 million strong, the generational group called baby boomers, that includes those born between 1946 and 1964, has been thought to understand the importance of fitness. This group is often credited with starting the fitness revolution in the 1970s and 1980s, embracing regular exercise, taking up jogging, joining health clubs, and following along with aerobics videos at home. Yet today, only a third of boomers now engage in regular exercise. That trend signifies a clear health issue, given that physical activity is well established as one of the most important steps that older adults can take to age well and manage or prevent health problems. For example, according to the Centers for Disease Control and Prevention, increasing activity is recommended to prevent, delay, manage, and/or lessen the severity of chronic illnesses. In addition, older adults who engage in more physical activity and less sitting time have better overall physical and mental health, as well as increased functional abilities, decreased risk of falls, improved motivation and mood, and decreased anxiety and depression. With National Senior Health and Fitness Day coming up on May 25th, we spoke with Dr. Todd Wisser at New West Physicians, part of Optum, to learn more.
15% of our population currently are over the age of 65, and that number is slated to just continue to increase by 2060. 25% of the U.S. population is going to be over 65. So it's hugely important to address that group, our population. Chronic disease, the other thing, as we age, and none of us are getting any younger, therefore, falls increase, the risks of chronic disease increase, diabetes, heart disease, musculoskeletal conditions, COPD, lung disease. Take your pick. As we age, things happen to us, right? So the importance of exercise becomes even more and more pivotal, and part of the reason we need to address that and encourage people to continue to do that. Exercise improves outcomes, decreases severity of disease, improves quality of life, improves mobility, decreases risk of falls, improves balance. So it's just hugely important. There's huge neurologic benefits from it as well. As far as dementia and things like that, exercise reduces that. And again, as people age, we're at more risk for increasing risk for chronic conditions and disease, unfortunately. So exercise is one of the best ways, though, evidence-based, to help negate or postpone or improve quality of life and decrease, again, disease severity and risk. So to set yourself up for success when looking at putting into place an exercise program is start low and go slow. Do something small. If you haven't moved in a while other than around your house, get outdoors, get some fresh air. Take a 10-minute walk 3 times a week if that feels good. You also want to certainly talk with your primary care physician before implementing an exercise program. Again, you want to start low and go slow and within something that's appropriate for you so you don't hurt yourself or injure yourself. But if done appropriately, exercise is wonderful. Biggest takeaway for me, for my patients here at New West Physicians, part of Optum, is find something that you like, that's sustainable. So when we talk about what types of exercise, again, it's more about what movement activity is fun for you, that's going to help and be sustainable, that you will continue to pursue.
New West Physicians, part of Optum, has been serving Denver patients for nearly 30 years. Their primary and specialty care doctors provide patient-centered care, backed by Optum's leading health services and technology. They are dedicated to helping our community live healthier while keeping care affordable. With decades of experience, 140 providers, and over 20 clinics throughout the Denver metro area, they are ready to see you. Visit nwphysicians.com to learn more.